Well, as we've been telling you for the last couple of weeks, the number of people receiving COVID vaccinations in Illinois and Chicago is declining.
We have seen a bit of a boost, though, with the approval of the Pfizer vaccine for kids ages 12 to 15. However, the numbers are low in many Latino neighborhoods. Joining us now to talk a little bit more about vaccinating more teens, we've got three folks right there. Dr. Geraldine Luna, wave hello, Geraldine. Dr. Margarita Reyna with the Chicago Department of Public Health, and Dr. Pamela Vergara with the Cook County Health Department. We have all three of you on here because all three of you have been visiting some of these communities, working on this issue for months now, so it's important to get your insight into this. I want to start with Dr. Luna, Geraldine Luna, to give me a sense of what's happening in the Latino community right now when it comes to the vaccinations, when it comes to the cases. What can you tell us?
Well, yes, thank you for having me. And we've seen a slow of the progression that initially we saw. And it's unfortunately like the case of prohibition with the J&J might have to do with it. But the structural barriers that we know communities are highly affected and systems that have been in place, discrimination, racism, has definitely taken toll. And we have seen it because of the importance of having trusted faces helping us out with the vaccination rollout initially. And now moving to this phase that we're literally sitting on vaccine, it's such an important thing to bring it to reflection, more reflection into action, to having our Latinx communities and African Americans communities vaccinated. It has been a turmoil, and we're desperately looking for incentive, dealing with this middle group, our youth. And now we know that we have Pfizer eligible now to be given to children 12 years and over. So this group is the middle group, which is not totally against, they're not anti-vaxxer, but they're not really prioritizing on vaccinating. They're just comfortable.
So let's take that issue to Dr. Reyna, because the vaccination rate is lower in the adult Latino community in general. And are we seeing that trickle down to the vaccination rate with 12 to 15-year-old Latinos?
Well, we don't have those numbers yet because this just started a few days ago. In the next few weeks, we will have those numbers for at least first dose because it is Pfizer, so folks need 2 doses. So we will have those numbers coming out in the next few weeks. But it's so important, specifically because the Latino population has almost 30% of its population in children under 18. It's so important to get those kids vaccinated to protect even the younger kids who aren't yet eligible.
Okay.
So,
and it's my understanding that you guys are kind of like going door to door vaccinating folks. So you will knock on a door and say, okay, is your family vaccinated? What's going on here? How can we help? So you're helping them right at their door, at their home. So talk to me about that and what you're hearing from some of the parents, some of the people living in a place like Little Village, let's say, or McKinley Park. And any one of you can take the question.
well, actually, this is part of the Protect Chicago and these health equity zones. We're prioritizing the communities hardest hit with lower vaccine coverage, right? And so there's folks that were contact tracers that are going door to door and talking to folks, right? Figuring out if maybe they don't know where to get the vaccine, or maybe it's they're too far away or they don't have transportation. So there's always solutions, whether it be some transportation vouchers that we have, or buses that come out parked right in their neighborhood, or a number of different community-based vaccine providers that come right to their door, like right around the corner. So sort of answering where they're at and figuring out and answering questions too. Maybe some parents have concerns to their doctor, and I would probably ask Dr. Vergara to speak on that too.
Yeah, and I just wanted to add that we do have our in-home program, Lourdes and panel, that we're extending now the services of going door to door, knocking on your doors, or if you want to make an appointment and have all the family ready to get the vaccine, anyone that is 65 years and older can call the city, make an appointment, and have us go there, visit you, and vaccinate your whole family right there with you. So this is an extension, and it's an important part of the initiatives of having our 65 years and older get vaccinated, which we know have the higher mortality of all ages.
I know you're
So-
trying to make it as easy as possible for folks. Mental health is certainly a component of all of this that has been especially underscored during the pandemic, oftentimes in specific neighborhoods. Let me ask Dr. Vergara to talk just a little bit about how mental health resources in Latino communities may play into all of this.
Absolutely. I think we all know, and I just want to make a very clear point about this, that this pandemic has brought on stress and anxiety at levels in all communities, but especially in communities of color and the Latinx population, which are a large group of essential workers. And many of these folks have had to live through multiple family members getting sick, being hospitalized. It's a very high level of stress, and especially for children and adolescents who have seen themselves and have had to live this situation that in their own homes and in their own families have seen other people be ill. And we know that even as adults, that feeling of helplessness can be traumatic. So now more than ever, we have this opportunity to use the vaccine to reach out to families, to adults and children and adolescents and our tweens, to take this step forward and access the vaccine. And I want to make a really important point. Just this week, the Kaiser Family Foundation put out a study that related that Latinos want to get vaccinated, but that still these structural barriers, particularly the fear of missing work, particularly the fear of having to pay for something that perhaps they feel they can't afford, or missing out on days of work if they happen to have side effects that are known expected side effects to the vaccine. These are actual structural barriers to the vaccine, which we are still trying to overcome by extending hours of vaccine, by trying to create community hyper-local, invading actual neighborhoods, and really trying to reach out to the community to give them that confidence that we can do this together.
Yeah, I know it's a topic that a lot of people want to focus on and devote some time to, and I know we'll be discussing it a lot more on Adelante Chicago coming up in the next few weeks. I appreciate your time so much, ladies, for weighing in on all of this. I know we'll talk to you again soon. Thank you.
Thank you.
Thank you.
Thank you.